Here we'll talk about anatomy of cornea, which is a transparent avascular watch glass-like structure. It forms anterior 1/6 of the outer fibrous coat of eyeball. So the dimensions are anterior surface and the posterior surface, and we'll also talk about the thickness of cornea. So the anterior surface, it is elliptical. That means the horizontal diameter is greater than the vertical diameter, leading to an elliptical shape. So the vertical diameter is 11 mm and the horizontal is 11.7 mm, and the posterior diameter is 11.5 mm. So remember the word 11. So it is something related to 11 mm, 11.7 mm and the 11.5 mm. So the thickness is 0.5 mm. Coming to the radius of curvature, the central 5 mm part of the area of cornea forms a powerful refracting surface, and the refractive index is around 1.4, that means like 1.376, and the refractive power is 60 D for the eye, and for cornea it is 45 diopter. It is important. For the eye it is 60, and for the cornea it is 45 diopter. The anterior surface of the cornea, it is around 43 to 44. Now coming to the layers of cornea, 6 layers are present. The newly added layer is Duas membrane. So the first layer is epithelium and the last layer is endothelium, we all know it, and the second layer is Bomas membrane, and the last second layer is Descemet's membrane, and in between you have stroma and the newly added Duas membrane. So let us talk about each of the layer in detail. Coming to the epithelium, what happens if the epithelium is lost? The cornea is more prone for the corneal ulcers, as the epithelium is a protective layer. Once the protective barrier is lost, leading to the infections by the different bacteria, fungi and viruses. So it is the outermost layer of the cornea. It is made up of stratified squamous non-keratinized epithelium. So it is 5 to 6 layers thick, and the basal layers are of columnar, and on the top of it you'll find the umbrella shaped cells, and on the topmost layer you'll find the flattened cells. So this is about the epithelium. And also in epithelium you'll have this tight junctions. What happens if you do not have these tight junctions? The tear fluid leaks from the epithelium towards the basement membrane and towards the stroma. To prevent this, we'll have this tight junction. So what is the importance of tear film? It makes the eye clear and glass-like, so that it is an important factor for the corneal transparency. Glycocalyx also makes the cornea hydrophilic, and the epithelium becomes continuous with the epithelium of bulbar conjunctiva at the point of limbus. So limbus, at the point of limbus, the epithelium of cornea and the epithelium of bulbar conjunctiva, the cornea and the conjunctiva becomes together. The limbal epithelium gets damaged, then the conjunctival epithelium invades into the cornea because of this mixture, because the both are present at the same point at the limbus. Because of the damage to the limbal point leads to the conjunctival invasion into the cornea. Bomas membrane. The importance of Bomas membrane and the Descemet's membrane is there is some difference between both of them. The both are resistive to the infections, right? Both are resistant to the infections, but one membrane is doesn't have the regeneration capacity, whereas the other has regeneration capacity. So the B comes first, so they do not have the regeneration capacity. Just remember it somehow. The Bomas membrane do not have the regeneration capacity. Therefore, it leads to the formation of scars and corneal opacity. Whereas in case of Descemet's membrane, you have the regeneration capacity. Therefore, no scar formation or the opacity occurs. But both are resistant to the infections, which is a good thing. So let us talk about this Bomas membrane. It is an acellular mass of condensed collagen fibers. Basically, there is stroma, right? So after epithelium, you have Bomas membrane. After that, you have stroma. What is stroma? Stroma contains collagen fibers. So some collagen fibers get condensed, and it forms a layer on the superficial part of stroma, which is called as Bomas membrane, right? So when you take milk, there is some layer gets condensed on the milk and it forms malai, right? Just remember it somehow. So that malai refers to Bomas membrane. There are mass of condensed collagen fibers. It is present in between epithelium and the stroma. It is present in between epithelium and the stroma. It is not true elastic membrane, but it is resistant to the infections, as we said earlier. It has no regeneration capacity. Therefore, it heals by scarring and the opacity formation. It is a condensed superficial part of the stroma. So the stroma is see the whole cornea is 0.5 mm thick, right? Out of this, the 90% of the contribution to the corneal thickness is because of the stroma. That's how it is important. See, it consists of collagen fibers. We all know it. What type of collagen fibers? Type 1, 5 and 6, which are embedded in the chondroitin sulfate and the keratin sulfate. and it also has few cells like macrocytes, leukocytes, keratocytes, histocytes. In stroma, just remember it is made up of collagen fibers which are parallel to each other and also parallel to the corneal plane, and also has different types of cells. If you see the diagram, you will easily understand it. And now coming to the Duas membrane, which is recently introduced in 2013 by Sir Harminder Dua, 15 micrometer thick, and it is an acellular structure that is very strong and impervious to air. So the clinical importance is corneal transplantation. Into the Descemet's membrane, I asked you to relate it with the Bowman's membrane, right? See, the Descemet membrane is separated from the stroma by Duas membrane. That means in between stroma and the Descemet's membrane, Duas membrane is present. And this Descemet's membrane is a strong homogeneous basement membrane of corneal endothelium. It's resistant to the chemical agents, trauma, pathological substances, pathological conditions, descemetocele, and it maintains the integrity of the eyeball. Same like that Bowman's membrane, right? So the Bowman's is resistant to infections, whereas this Descemet's is resistant to infections, trauma, descemetocele, and many more things, and maintains the integrity of the eyeball. Like it maintains everything. Regeneration is possible, therefore no scar formation or the no opacity occurs in the eye. In the periphery, if it appears to end at the anterior limit of the trabecular meshwork at Schwalbe's line. And endothelium. So endothelium, these are flat polygonal epithelial cells which are in the shape of hexagonal. These appear mosaic in the slit lamp. So the cell density, that means see, per mm square you need to have this much cells in the endothelium. That means per mm square you need to have 3000 cells. This is the cell density of endothelium. If it decreases, you'll lead to some problems. We'll see about it. See, these cells are limited in our body, right? They do not increase as the age increases. These are just limited from the birth. So as the age increases, the cell size can increase, but the cell number do not increase. No regeneration capacity, but it has increase in the size capacity. So if the count is between 500 to the 2400, it is okay. It can be managed with the size enlargement or in migration with the help of neighboring cells. Some adaptations are possible if it is in between 500 to 2400 cells per mm square. But if the count of the endothelial cells decreases or the falls below 500, it leads to corneal haziness or the edematous cornea. Why? We'll see. See, in this picture you can see, imagine this is cornea, right? These are the layers of cornea, and the last layer is endothelium. And what is present after the endothelium? There is aqueous humor. Aqueous humor is always wet, right? It is what happens when you keep your hand in the water for the long time. It becomes edematous, right? It becomes wet. I don't know how to say it, but it becomes edematous or the hazy. See, that's what happens with the cornea. If there is deficiency in the endothelium, it leads to corneal haziness or the edematous cornea. That's why it is very important for us to maintain the endothelial cells number, and also endothelium must be maintained in the dehydration condition. See, imagine the endothelium is present in some in Kashmir, okay? So it need to maintain it by wearing sweaters or some kind of mechanisms must be gone to keep it warm in the winter season or normally in all times, right? Because the endothelium is always in contact with the wet aqueous humor. We need to protect it with the help of dehydration. How will the dehydration occur? By pumping out the excessive fluid away from the cornea. So it takes the water from the cornea and pumps out into the aqueous humor. So the endothelium is also cornea, right? It is a layer of cornea. It takes the water from the cornea and pumps it into the aqueous humor, thereby making the cornea dehydrated state. So the active NAK ATPase pump is present to maintain the corneal dehydration. So the fluid is pumped away from the cornea into the aqueous humor, and the tight junctions are also present in between the endothelial cells. So this is about endothelium. Once just summarize this. Epithelium, remember the stratified squamous non-keratinized epithelium and describe about it, like 5 to 6 layers and what types of cells are present in it. Like the columnar cells are present at the base, umbrella cells followed by the flattened cells. And also write about the tight junctions in the epithelium, and also the tight junctions come in case of endothelium. Study it along with the Descemet's membrane. Both are resistant to infections. One is regenerative but another is not regenerative. Therefore, the non-regenerative part leads to the scarring. So the scarring is seen in the Bowman's membrane. And coming to the stroma, first point is thickness. Second point is collagen fibers. Third point is cells, right? And now coming to the Duas membrane, it is newly introduced membrane, a cellular structure that is very strong and impervious to air. Now coming to the Descemet's membrane, again it is resistant to infections, trauma and pathological agents. Regeneration is possible, therefore it doesn't lead to any scarring. Coming to endothelium, we wrote about this whole Jammu and Kashmir story, right? This 3000 cells should be maintained. This is the cell density. If the cell count falls below the 500, it leads to the edematous condition of the cornea because it is in contact with the aqueous humor, so we need to maintain in the dehydration. Just write the story. And now coming to the blood supply of the cornea, it is avascular, but the loops of cups, subconjunctival tissue can be present. Nerve supply, trigeminal nerve, it has three parts. It is divided into three parts, right? One is ophthalmic division, maxillary division, mandibular division. So the ophthalmic is again divided into three things. One is frontal, nasociliary and the lacrimal. So this nasociliary part of the ophthalmic division of the trigeminal nerve supplies to the eye. After going down 2 mm, so what is the importance of this ophthalmic division of the trigeminal nerve? Nerve doesn't have myelin sheath. What happens if it has myelin sheath? The myelin sheath is opaque in structure properly. We cannot see the things clearly if it is opaque. That's why the myelin sheath is absent, leading to the corneal transparency. Factors responsible for the corneal transparency. One, we just said the myelin sheath is absent, and second, we also said the endothelium pumps out excessive water so that the cornea doesn't become edematous or hazy. That means it is also responsible for the transparency. And also we also said this epithelium has tight junctions so that the tears doesn't leak from the epithelium to the bomas to the stroma. So this tear film is very important. Why? It makes our cornea clear and transparent. So the three things are done here. And also the corneal is avascular. The of stromal lamellae is parallel. It is of two theories. One is Morris theory and Goldman's theory. Just remember it. So to remember the every factor, I made a mnemonic male. M refers to myelination, no myelination, right, of the nerves. And A refers to avascular. L refers to stromal lamellae. E refers to pumping out excessive water from the endothelium. The other E refers to epithelium tear film maintenance. So see, this is about corneal transparency and anatomy of cornea.